We must continue to increase our bed capacity.
That statement was almost an afterthought back on March 25th. The state had just closed all schools, declared a public health emergency. People were getting sick and employees were losing their jobs. But the following day, Governor Doug Ducey issued an executive order to increase hospital bed capacity by 50%. That day, there were 741 ICU beds in use throughout Arizona, with 1,199 available. This graph shows how the numbers of beds and patients rose, then stayed relatively stable until April 8th. That is when the state saw a surge in ICU patients. If the number of available beds had remained the same as it was on March 26th, we would have been overrun, overwhelmed, and over our ICU capacity. It was a rush behind the scenes by hospitals across Arizona to implement emergency surge capacity, and it worked.
Today we have 1,668 plus 485 additional beds available as needed.
That was Governor Ducey yesterday, a little less than 1 month after signing the executive order.
This is good news, and it shows we're prepared in Arizona.
So we got this data about 2 days ago, and we've been plotting it on a timeline that shows you where we are in terms of beds that are being used and available beds and available ventilators day by day. And we put it all on our website. You can find it at azfamily.com and our AZ Family mobile app. Brandon, Chris, back to you guys.
You know what, Morgan, I will say what a big sign of relief to know that we do have that capacity to take on more patients if we do see another surge. But let's go back to that surge you were talking about on April 8th. Do we know how many of those ICU patients were even infected with COVID-19?
Yeah, so for the past 2 weeks, it's ranged between about 250 to 305, depending on what day it is. It's not a huge amount. It's between 12 and 20%, but it is enough where hospitals really did need to increase their capacity in order to handle that number.
Well, great reporting tonight by our chief investigative reporter, Morgan Lowe. Thank you.